A poll that just came out that says a majority of Americans support a public option, and yet Max Baucus, Democratic chairman of the Senate Finance Committee, is putting in a bill that does not include the public option, believing that moderates and Republicans will not go along with it. Why is that dynamic happening if the public supports a public option?
Well, I think we have to reflect what the public's interests are, and that's why I'm a strong supporter of the public option, and I think that message has got to get across to...
I guess I'm asking about the framing. Why, when there's public support, is that still a roadblock?
Well, but you have the Senate, which has done that. You have the House of Representatives that just put forward, their outline of where we should go and what we ought to do, and it's more than an outline where the public option.
Right, the House has put it in.
But it's going to be a debate, and I encourage people to make their voices heard in this process, because we should reflect what the public is interested. Folks out there who say, if government gets involved, they're not going to have the same benefits, etc. I think we need to demonstrate that this is a proper role for government to engage in, and that we will have a benefit package that is comparable to what is being offered. People will just have a choice of a number of private plans. They'll have a public plan from which to make a choice as to what best fits their set of circumstances.
Opponents of plans say, insurance companies won't be able to compete because the public option will be better. Is that a problem?
Well, I think, I think that in order to be able to get a piece of the market, I think we'll find that the insurance companies will find a way to compete.
And if they couldn't, is that a problem? Is it a concern for the insurance companies or for the plans?
I think that's speculative. I think that there is a role. People today, one of the most interesting things is that there is an overwhelming interest in a public option, but there is an overwhelming interest in holding on to what you have if you like what you have. So that's what we're trying to provide, is a hybrid, if you will, that says if you have what you like and it's private insurance, stay there. But if you want the opportunity for a public option, that's there for you as well.